Hi everyone, thank you for being volunteers at Fran. This short video is going to help you get a better understanding of how to optimize your documentation. This is Shanu Gupta. I'm one of the physicians that normally volunteers along with you at the Fran clinic. A couple of years ago, the team or the steers put together this electronic health record so that we could better capture data from our patients and hopefully help to serve our population better as well. So you may already have been introduced to Practice Fusion, but this is what it looks like. Once I sign in, I get a list of patients, and here's a patient that we've recently seen and taken care of. So I'm going to open up on the right here an encounter. And this is what I would normally see when I open up an encounter. So this is their SOAP note. The note has the date when it was first created, who it was created by, who this patient was seen by, their age. At the beginning there is a chief complaint. Now the chief complaint should always be filled out. You notice here it's empty. Then it's flow sheets after that. The flow sheets normally capture all the vital signs. So Mr. Demo Primary Care here has grown in height, it would seem, in the 1 year that he's been with us, and also lost a significant amount of weight. Sadly, his BMI has fallen below normal levels. You can also see his vital signs of blood pressure, temperature, pulse, respiratory rate, saturations, and there are other things you can add in here. So for example, for diabetics, if we are checking a blood glucose, this is the place that it will be added. Things like head circumference are really for pediatric patients, and those are not the types of patients that we will be seeing in this particular clinic. After that, what you'll see is subjective, which is where you will place all the information that you gathered from the patient during your interview. So what's the reason they came in, their HPI essentially. Objective is where you place your physical exam findings. The vitals are already included in the flow sheet, as we mentioned earlier. The assessment is essentially your problem list. So number one is whatever their major problem is that they came in with. And sometimes you'll find that our patients come in with more than one complaint. And then the plan is what you did about it. And in that plan, you can actually place orders, or if you started them on new medications or gave them refills of any medications, it's important for us to document all of those in here. At Fran, currently, we do not have the capability to do any labs or imaging. So we're usually not using these buttons here. And again, we are not doing any screenings. We're really much more of an urgent care model. And so we're not normally filling out the rest of these sections here. So let's open up a note that we had already started. I'm going to minimize these notifications, and I'm going to ensure that all the information up here is appropriate. Okay, so you'll notice here that Mr. Demo Primary Care came in with right ear pain. So the chief complaint is written right here, right ear pain. Flow sheets, as I mentioned, have already been filled out. The diagnoses have been recorded. So if you want to add another diagnosis, you can click on record, add a diagnosis of hypertension. I'm going to say primary hypertension, and I'm going to say it's acute. The reason it's important for us to have these in here is for data collection. It makes it much easier for us to pull information about all hypertensives if the hypertension or any other disease is already documented in here. So that's helpful for that reason. Allergies, the way to record is to be able to type in here, let's say amoxicillin. Very mild severity rash, generalized. And childhood, save. Food allergies are also important and documented in a similar fashion. Looks like he had amoxicillin in the past, and that's probably where he experienced his allergy. Social history, again, it's really important for us to document this and record it rather than typing it freehand, so that we can gather data when we do quality improvement studies in the future. And again, for all of this other information. Past medical history, I'm going to write in here, cholecystectomy 2007. And you can also add other histories in here that may not otherwise have noted. Okay, in terms of subjective, this is a really well documented note. So again, you would just click edit and you should be able to document in here. So it turns out that Mr. Demo Primary Care is a 40-year-old smoker with no significant past medical history, came in with 5 days of progressively worsening right ear pain. So again, this is really your HPI. The review of systems has been entered here as well. You may or may not want to be as thorough as this, depending on what you are faced with in terms of the patient. When you click on the button to the bottom right, you'll be taken to the objective. And again, here is a very well documented physical exam. Remember, if you did the maneuver, document the maneuver. It's really important. And it's important to document the pertinent positives as well as the pertinent negatives. Next, we'll go to the assessment. And the diagnoses have already been entered in here. So we've decided that Mr. Demo Primary Care has otitis media of the right ear, and he also has essential hypertension, although today his blood pressure is actually low. So our plan, instead of amoxicillin, because we realized he had an allergy, let's change this to ciprofloxacin, and I'm going to delete this, and I will attach the medications shortly. We're going to ask him to come back in 2 weeks just to make sure that his otitis is actually resolved. And save. And then you should be left with a great looking note. And this is helpful for me when I'm going back to sign your note afterwards, because now I know exactly what we talked about, exactly what we examined, and exactly what we did for the patient. Usually, if you have missed some of these details, I will go back and fill them in, but in the course of an evening, we can often see up to 15 different patients, and it can be challenging for me to remember the details of every single one. So it's really helpful for me if you document all of this in this manner. And then, of course, you would just click sign, and you may have been shown how to forward that to your attending already, but that's it. If you have questions or concerns, please email, call, text, page, and I'm so excited to work with you all in taking care of this really important population for us.